Hello, and welcome to this LinkedIn Live panel discussion. I'm Sasha Boziat. I work in the Global Medical Affairs team at Roche, and it's my pleasure to be the moderator of this session today. It's a historic day for the Alzheimer's disease community with the announcement of the positive phase 3 readout of an anti-amyloid therapy, which brings great hope to people living with Alzheimer's disease. We're not going to be discussing this news further today because the focus of our topic of our discussion today is brain health and dementia risk factors. In 2015, the FINGER trial was the first RCT to demonstrate a positive impact of multi-domain lifestyle intervention on cognitive function in an at-risk dementia population. This study was really the catalyst of a whole wave of research into the impact of lifestyle on dementia risk and outcome. And we've since seen the Lancet Commission propose that up to 40% of dementia cases could be prevented by managing modifiable risk factors. Today, I'm joined by 3 experts in the field, and together we're going to discuss the existing evidence and in particular what that means for population and individual dementia risk reduction. We would really like to encourage a positive and open, engaging conversation with you here today. So please feel free to post your comments and submit your questions via the chat function. But I would ask to remind you, all of the panelists and those joining from home, that this is not the forum for discussion of medical advice, and I would ask people to refrain from mentioning any medications by name. Please respect the panelists and make sure that your comments and that your questions are appropriate and relevant to the topic that we're discussing today. So we have about 30 minutes of pre-prepared questions, and then we will have some time for your questions at the end. So don't forget to submit them via the chat function. I'd now like to ask our 3 panelists to join me and to introduce themselves. Anja, let's start with you. Welcome.
Hello, thank you. My name is Anja Leist. I'm Associate Professor in Public Health and Aging and Vice Head of the Institute for Research on Socioeconomic Inequality at the University of Luxembourg. We are investigating social and behavioral factors in cognitive aging and dementia with a focus on inequalities related to gender and socioeconomic status.
Fantastic to have you here, Anja. Thank you very much for joining us. Andrea, over to you.
Hello, my name is Andrea Fairley. I am a dietitian and lecturer in nutrition and dietetics at Newcastle University in the United Kingdom. My research is in the area of diet and dementia prevention, so I'm really interested in looking at how diet has a role to play in promoting brain health through testing this in intervention studies.
Welcome, Andrea. Thank you. And last but by no means least, Anna Carolina.
Hello, so I'm Ana Carolina Santos. I'm a doctor in basic psychology, and currently I am a postdoc researcher at the University of Luxembourg. And I've been working in the field of non-pharmacological interventions to promote health in aging. And it is a pleasure to be here today discuss this important topic. Thank you.
It's a pleasure to have you, all 3 real experts in the field. I think we're going to have a great discussion today. I'd like to start by asking you, Andrea, what are the major risk factors for dementia that have been identified and which ones might be modifiable?
I think many people affected by dementia are concerned that they might inherit or pass on dementia to members of their family. And there can be a genetic link associated with the rarer types of dementia, but I think we need to remember that dementia is a very complex disease and may develop as a result of a number of different risk factors. And what we know is that there are certain risk factors that can increase our risk of developing dementia. And some of these risk factors we can't change. So, for example, our age or ethnicity. But what we do know and what is really hopeful is that there are modifiable risk factors that we can control and that we can change. And the Lancet Commission on Dementia Prevention was really landmark in publicising this. And this publication demonstrated that up to 40% of dementia cases could be prevented or delayed by modifying 12 modifiable risk factors across the life course. So these factors are things like obesity, diabetes, blood pressure, physical activity. So these are all factors that we can take control of, and this is really hopeful for dementia prevention.
Absolutely. And Anya, do you have anything further to add on that one?
Yeah, Andrea has already alluded to it very nicely that many people don't know about the modifiability of dementia risk. So what we call brain health literacy, so the awareness and knowledge about brain health, about the possibility to reduce dementia risk, this is not very common. People, for example, in studies report that they feel genetic and modifiable risk factors are equally important when in fact genetic risk does, according to the latest evidence, not contribute so dramatically. So one important step forward will be to increase brain health literacy of the population and help people understand their potential to modify dementia risk.
So it's really quite a lot of education still that needs to be done in sort of people understanding, untangling what's the contribution of those modifiable versus non-modifiable risk factors. And I'm sure that there's people listening at home who are thinking, when should I start these risk reduction measures? Anna Carolina, what's the sort of optimal time for intervention, if you like?
I would say that it is the whole lifespan, as it is stated in the Lancet Commission report. It's never too early and never too late to prevent dementia. So it's important to guarantee education in early life and from middle age, as Andrea said before, we should start preventing the other risk factors as preventing hearing loss, hypertension, obesity, traumatic brain injury, and so on. But in general, we will benefit from having a healthier lifestyle at any time of our life. And I would say, especially for lower socioeconomic status individuals who are more exposed to the risk factors and consequently are more vulnerable to dementia.
Absolutely. And Andrea, as a dietitian, you're more aware than any of us of the role of nutrition on health generally. But what about nutrition and brain health and your subsequent risk of developing dementia?
Yeah, absolutely. So it is possible that consuming certain foods or certain combinations of foods can have an influence on those biological mechanisms that contribute to the development of dementia. But also, as discussed, these modifiable risk factors such as blood pressure, obesity, diabetes have a direct link with the foods that we eat. So it's really important when we're thinking about dementia prevention that we're thinking about our diet and what foods we're consuming. So, for example, eating too much sugar or eating too much salt has been long standing proven that it's related to blood pressure and increasing blood pressure. And we now know through the Lancet Commission that having high blood pressure puts us at high risk of developing dementia. But not only that, things like consuming excess amounts of foods that are high in saturated fat or high in sugar can lead to excess weight gain in combination with limited physical activity, for example. So we know that it's a multifactorial prevention that we need to look at in terms of thinking of the wider risk factors that can contribute to this alongside diet. So we need to think about this across the life course and thinking about the foods that we're consuming in combination with our wider lifestyle practices.
Absolutely. And so the adage then, what's good for your brain, what's good for your heart is good for your brain, is actually stands kind of pretty true then, really. And we hear a lot about cognitive reserve these days. Anya, can you explain to us what do we mean by cognitive reserve?
Yeah, cognitive reserve is related to the socio-behavioral factors. So in contrast to biological or medical or nutrition-related factors, we measure it with the level of education, level of occupational complexity. That means which responsibility do people have in their jobs for things, ideas, or persons. But even if you don't have these factors, if you don't have high education or a high occupation, you can still increase cognitive reserve through cognitively stimulating activities. could be cognitive training, but could also be leisure or social activities with a cognitive component. And that has been shown to compensate for brain pathology. So if we look at people with a high brain pathology, people with a high cognitive reserve on top are usually able to compensate and maintain normal functioning, maintain normal cognitive performance.
So there's different elements there. Then there's education, and then there's obviously the kind of ongoing cognitive stimulation or training, as you call it. Anna Carolina, are there kind of specific things that we can do to boost our cognitive reserve? What's the evidence for that?
The recommendation is to keep cognitively, physically, and socially active. And the studies with older adults have shown significant effects of cognitive training to improve cognition and also to maintain instrumental activities of daily living. However, there is no strong evidence that these effects can be generalized for other domains not trained. So additionally, interventions such as hearing aids or measures to avoid excessive alcohol are important to preserve brain health. Yet physical exercise in midlife protects from dementia, enhance hippocampal neurogenesis, decreasing obesity, diabetes, cardiovascular risk, and depression, which is also a risk factor for dementia. Other factors such as sleeping, traveling, social arts, playing music, art, reading, speaking a second language, engaging in intellectual activities are all associated with cognitive health. And also, not to mention the importance of stress management to promote health. Chronic stress can exacerbate imbalance of neural circuitry, and it may influence personal behaviors such as smoking, eating too much, drinking in the sense of excessive alcohol consumption, and have poor quality of sleep. Though intervention target stress are also important to be considered, and the mindfulness-based programs have shown to have an important impact on stress reduction and cognition in older adults. Therefore, we can see that all these single domain interventions are important, but there is no robust evidence showing its potential for preventing dementia. So an alternative could be the multi-domain interventions targeting multiple of these domains. And I believe that we are moving forward to more individualized and holistic intervention, considering all these factors and the needs of the individuals.
So individuals will be better placed to think about many different risk factors and do make maybe small changes to those kind of, lifestyles and small changes to those risk factors rather than focusing really on one thing, let's say like boosting cognitive reserve, but make sure that you manage the diet, the exercise, the smoking, all of these things to really kind of see a positive impact. And we've heard a lot about, role of lifestyle and education in dementia risk, which of course leads us to think about the kind of socioeconomic and cultural factors that might be at play. And yeah, I mean, how important are these and is these as considerations for us?
Yeah, so socioeconomic and cultural factors definitely very important. We are building here on a really strong research line on the social determinants of health, and we now see more and more evidence that it's the same for brain health and dementia. In a recent study, for example, with UK data, we have been looking at neighborhood deprivation, socioeconomic deprivation, and the risk of getting dementia, developing dementia over time. And even after controlling for genetic risk for developing dementia, we saw that those in the most disadvantaged group in terms of neighborhood deprivation had a higher risk of developing dementia, and also adjusting for depression, education, and lifestyle. So that was really a strong study linking with other research showing about the importance of socioeconomic factors.
Absolutely. And Anna Carolina, what needs to be considered when we're developing targeted approaches to dementia prevention in relation to the modifiable risk factors?
I can give an example of a trial that we are currently running here in Luxembourg. So we are running this trial with two groups based approach with other Portuguese-speaking migrants, and one focusing more on mindfulness training, I mean meditation, breathing, yoga, and management of stress reduction. And the other is a lifestyle intervention focusing on sleep quality, nutrition, physical activity, leisure activity, and cognitive stimulation. And we assume that this population has a higher vulnerability for cognitive decline, since they often had lower level of education, they worked in manual jobs, and sometimes had less social support, as many of them are living far away from their loved ones and face language barriers. So, in fact, many participants who experienced social isolation in our programs reported that the group delivered intervention helped them to overcome loneliness. And one important strategy that we used was to offer the group intervention in their mother language, which we believe was crucial to the adherence of participants. So we are still in the data collection phase, but from the participants' reports, we realized that they are being able to use both mindfulness techniques and health promotion information as research to develop healthier life habits. And we believe that these individuals would benefit from psychological support and intervention that allow them to identify and discuss their needs and barriers, for therefore be able to build in the community research to develop their health. In one group, for example, participants developed a group in a social media app in which they exchange their new health habits and support each other in their small steps to build healthier lifestyle and well-being. So answering the question, I believe that together with public policies, we should consider individuals as protagonists in the process of developing these mechanisms to target dementia prevention.
Absolutely. So it's a kind of personalized approach. It's not a one size fits all. And we've heard that it's a multifactorial, multi-factors to be considered when we think about dementia prevention and improving outcome. So if we think about on an individual level, and for the audience joining us from home, are there kind of practical suggestions that you would give to people in making some of those small but meaningful changes? Anya, let's start with you on this one.
Well, one of the ideas as a psychologist is that I really like myself is to think about not improving my lifestyle because of fear of getting dementia, but rather thinking about positive goals for the future. What do I want to do in, I don't know, 1 or 2 decades or 3 decades? People tell me about that they want to see their grandchildren growing up. They want to go on vacations. They want to continue keep doing things themselves. So these positive goals can help maintain positive lifestyle changes.
I really like that advice, because I think generally brain health has traditionally been framed around, as you say, a fear of getting dementia, and it becomes a kind of bit of a negative connotation. But of course, it should be about maintaining brain health, to be performing better, to be feeling better, to be enjoying life more. So I love the idea of kind of reframing the narrative on brain health. Andrea, what about you? What sort of practical suggestions would you make to people?
Yeah, absolutely. So, in relation to diet, people can become quite fearful about having to change their diet and think they have to ratify and change completely everything that they eat or that they're consuming. But actually, research shows the small changes can actually reap big benefits. So just like you said earlier, Sasha, thinking about what's good for your heart is good for your brain. So that works for foods as well. So thinking like simple swaps, like perhaps eating more oily fish instead of red and processed meat throughout the week, swapping white breads for whole grain varieties, eating more fruit and vegetables as snack options instead of foods that are high in saturated fat and sugar. Those are little things that can be incorporated into someone's diet and really have those benefits in the long term.
Excellent. Thank you for sharing. And Anna Carolina, practical advice for our audience listening at home.
I would say to introduce small steps each time, to not to be overwhelmed with change everything in the lifestyle. So I would say just start with small things every day, and then we can see a big result.
Yeah, I think that's great advice. The challenge with something like this, where you have a long list of potentially modifiable risk factors, is that one feels like one has to change everything at the same time. And then, of course, it feels a little bit like an uphill struggle and like a task you wouldn't be able to complete. So then, of course, there's a sense of, well, okay, I don't really do anything. A little bit of inertia kicks in. So I really like the idea and the recommendation that actually small changes can still make a difference, and it's still worth implementing those. So hopefully that's good advice for people listening at home. And one thing we haven't really talked about, which I'm interested in, you touched upon it, I think, Andrea, this issue of adherence and to dietary changes and lifestyle. You know, we are, you know, creatures of habit generally, and we get ourselves into a routine with what we eat and how we live. How difficult is it to get people to make changes in diet and lifestyle, and what kind of strategies can we use to encourage them and support them in that?
Yeah, absolutely. I think it's really difficult to change those routines and habits that we're so used to that we do without even thinking. So I think it links into everything that we've talked about, making those small changes first and building it up over a period of time can really help establish those as habits in your own routine. So thinking about making small, simple swaps in your diet over a period of time can help build that habit and it can become a routine in your lifestyle. It's a real big challenge that we see right across dietetics. Helping to support and motivate behavior change is challenging, and that's why it's really important within dementia prevention research that we're understanding the needs and the values of our communities that we're working with, so that we're developing resources and advice and guidance that suits their needs, their cultures, and the settings that they're living in, and tying in those socioeconomic factors that we need to consider when someone's wanting to change their diet and lifestyle.
Absolutely. And Anna Carolina, you also mentioned, I think, about adherence and in a kind of clinical trial setting. But you know, how does that sort of translate into kind of, you know, everyday clinical practice, let's say? What kind of strategies could we employ there?
Mhm. I will not focus on the risk factors per se, because one thing that called more my attention was when we do the intervention in group, we can achieve better results. So in our group, for example, when we are teaching nutrition, they all started to apply it in their lives, and then the participants change a little bit the way they eat, and they stimulate each other to change also. So I think here is the key to make the change is to focus on the group, on the family also, because this change alone is more difficult. So I would say that we could take advantage of this in our clinical practice.
Yeah, yeah. And Anya, and anything further to add on that?
Yeah, that's such an important point that Anna Carolina just mentioned, the social factors, right? For physical activity, it's also been shown that it's much easier to maintain a physically active lifestyle if it's done in a group or if it's done as a social activity rather than kind of a long-term vague idea of a physical benefit, which then, of course, will be added, but the social aspect is really the most important. Maybe we can also just reiterate the fact that people can search how to adapt their preferences and needs to the recommendations. So, of course, the World Health Organization, for example, advises 2.5 hours of moderate activity during the week, but we don't need to go to the gym for that. We can also do brisk walks or some exercises or dancing at home. So it's really about get moving and not about having strenuous exercise that not many people like. Actually,
absolutely. Make it fun and enjoyable for people, so people actually want to stick to it. Yeah, that's great advice. Well, I think we probably got some questions or some comments coming in from the audience. I hope that we have. I'm not able to see them yet, but hopefully we get something through in the chat. Yes, here we are. So this year's World Alzheimer's Report highlights prevention and management of atrial fibrillation in the risk reduction strategies. Can you comment on that? We touched a little bit on this at the cardiovascular risk factors, but yes. Would anybody like to take that one a little bit further?
Well, I can try and the others jump in when I get stuck. Well, already the finger trial, the results of which were published in 2015, had that kind of strategy to manage the cardiovascular risk factors. So it would be ideal if people went for a preventive checkup to their medical doctor and to their GP and just help reduce the more obvious medical risk factors, and then on top of that, also add the lifestyle factors.
Absolutely. Great advice. Anybody else want to add anything on that one?
I would just want to reiterate what we said, that what's good for your heart is good for your brain. So keeping that in mind when considering advice like this, that you're thinking that about your diet and lifestyle to affect a range of different conditions. So it's important to keep that in your mind as well.
Yeah. So you're not just you're benefiting your general health, let's say. And I think that's something which we haven't kind of discussed in detail, but it's a good point that you raised there, Anya, about making sure that you get regular checkups and you manage things like the cardiovascular risk factors, that the diabetes risk, that hearing loss, these kind of let's say more kind of medical conditions that could be give you a predisposition or an increased risk of developing dementia. We've got another question coming in on the chat here. So how might dementia risk reduction measures be different in low and middle income countries versus those in Western countries? A very important question. Yes, we haven't really touched too much upon this topic yet. Anna Carolina, do you have a comment on this one?
Yeah, sure. I just want to do also a comment regarding the previous question, because in our group, we also see that participants started to not ignore symptoms, because before they thought that when they have they feel something in the heart, or they ignore the symptoms. So now they are going more to the doctor, comment those symptoms that they thought that were not relevant. I think it is good to teach them to see the body, to report all these symptoms. And yes, regarding the low and the middle income countries, we see that in this country, the dementia rate is not decreasing. So it's necessary to think about policies that will protect people from these countries. What should we do in those countries to improve the quality of life, to change the lifestyle, especially, for example, for the women, that the prevalence is higher than for men, For rural population, it's also higher. So we need to identify the needs of this population and do specific policies for this group. It's really important at the moment.
Absolutely. And it's very hard, I think, when many of these countries won't have specific policies on dementia, and may not have dementia on their priority list. They have many other health conditions to manage. But of course, as we know, prevention is always better than cure. It's always better to try to prevent, especially these cases that can be. Andrea, any thoughts on this issue in low middle income countries?
Yeah, absolutely. It's a really important issue because we are seeing the rates of dementia rising in these settings, and perhaps that's due to the growth of an aging population and the ability of these countries, the inability of these countries to be able to support the care needs for patients with dementia. We're also seeing more people in these settings having these risk factors. So we're seeing a growth in the prevalence of type 2 diabetes, for example, in these settings. So we need to really prioritize research in these settings, as Anya said, looking at the needs and the values of the residents in these communities, so that we can really provide culturally adapted resources and advice around diet and lifestyle that's going to suit their needs and the resources that they've got available to them in these settings. So I think it's really important that we're focusing our attention on that so that we can really provide that tailored information.
Absolutely. Anya, anything further to add on that one?
Well, I'm reminded of the work our colleague Fabiana Ribeiro is doing on the Latin American context, where we really see about that increase in risk factor prevalence. We see the gender gap, so higher prevalence of dementia in women, and these kind of favorable trajectories we see in the Western countries is just not visible, specifically for the Latin American context. What I want to mention again is to support with socioeconomic resources, with economic resources, because already in many Western countries, people in the lowest income percentile don't have the means to actually follow healthy nutrition advice. And that's really such an important factor to prevent obesity and diabetes, just as Andrea has said.
Absolutely. Well, sadly, we're out of time. That just went by in a flash. We've got one question that's just popped up, which I'm going to try to sneak in here as a closing question. So now that we've got the recognition of brain health as critical and that we've identified risk factors, what is the future for diet and dementia prevention research? We'll have to keep our answers fairly short. I'll come to you first on this, Anya.
I'm really excited to hear Andrea's views on that because I'm not the specialist here. So I give the floor to Andrea.
Over to Andrea.
Oh, thanks, Anya. So I think now that we know that this is such an important aspect that we need to focus on, we need to let the public know. We need to raise the profile of prevention and promoting brain health and getting these key prevention messages out there in relation to diet and lifestyle and what someone can do to reduce that risk. So we need to prioritize increasing awareness, but we also then need to prioritize research in these most disadvantaged communities that have the greatest need to understand their needs and values in order to be able to tailor the advice to support their ability to change their diet and lifestyle going forward.
Absolutely. Any last words from you, Anna Carolina, on this?
Yes, I was thinking about the importance of clinical trials in this regard because most of the studies are observational. So I think that research that randomized controlled trials that follow participants over time is really important to consolidate the field.
Absolutely. And we're seeing, that becoming much more the case now. I think the finger trial was, really a little bit of a landmark study, as you pointed out. And of course, that's had a huge impact. And we now have the worldwide fingers, which is finger trials across the world, which is really fantastic. And I think we've moved from, as you say, rather kind of, observational research to actually, well-conducted RCT trials of multi-domain intervention, lifestyle intervention. So I think, we can be probably quite clear that this is the future for research in dementia prevention. Well, it's been an absolutely fantastic discussion. I think we could talk a lot longer about this, but sadly we're out of time. I think we'll have to organize a follow-up session to discuss more on this fascinating topic. I would like to thank you very much, my brilliant panelists. You've inspired us, you've educated us today, and thank you very much for taking the time to join us. Thank you at home for joining us. I really hope that it's been a half an hour well spent for you, and I hope you've got some good learnings and some good advice to adopt a healthy lifestyle moving forward. I would just like to finish by thanking the World Young Dementia Leaders who have actually helped us to convene this panel. So thank you very much to them. If you've enjoyed it today and you'd like to hear more from us on LinkedIn Live, then do check out the LinkedIn Live page and watch for updates, and there'll be more of these sessions coming your way soon. So it just leaves me to say, have a very nice day, and thank you very much to everybody. Bye-bye.
Bye. Thank you.
Thank you.